Hello, welcome back. The topic today is visceral fat or the organ fat. So, what is that? So, like any other fat, it's a fat, but it is deposited on the organs inside the stomach. So, the subcutaneous fat, that's the fat below the skin. You can see, you can pinch, you can measure easily. But this organ fat is a different one, which you cannot see. To measure that, you need expensive scans to calculate the amount of fat. But what is that fat? In fact, in one way, it's a good fat. In fact, it's called active fat, where it usually helps the function of that particular organ. Suppose you have fat deposition on the small intestine, large intestine, kidney, liver, pancreas, anywhere it can get deposited. But it also helps. But if it is more than what is required, it is definitely not healthy. It can endanger your health. So the organ fat compared to the subcutaneous fat, the organ fat is more dangerous. But when you are losing weight or when you are reducing your fat level, the first one to disappear will be organ fat. The subcutaneous fat or the external fat takes longer time to disappear. That is why when you do exercise or in a weight reduction program, probably you may lose a little bit of weight, but your appearance may not show that much of fat loss externally, but it's happening inside in a better way for a better health. So keep doing exercise or keep reducing a fat level. So okay, what is if suppose you have a excess organ fat, what are the things can happen? Definitely it can endanger your health, like your heart, your diabetes can happen, cholesterol can happen, and especially cancers like colon cancer, pancreatic cancers. They're all depend mainly on the organ fat. And not only that, suppose you have too much of fat on the organ, their function also can get reduced. Suppose you have a small intestine which has to move to propel the food and motion down. Suppose you have too much of fat deposition on the colon or the small intestine, they become heavier. So the intestine movements come slower, so they can easily get constipation and the related health issues. The same way, the since you cannot see the fat, most of the thin individuals think they are healthy, they don't have any organ fat. No, even if you are thin, even if you are normal weight, so you may have organ fat or visceral fat more than what is required for the body. So to measure that, there is only way is to you need some expensive scans to measure that. So even if you're thin, always think you can have excess fat on the viscera. How to measure? Very simply, of course, your body weight, BMI, waist circumference. Suppose somebody is uniformly overweight, the chances of organ fat is little lesser. There is a possibility of organ fat or visceral fat is high, but suppose somebody is uniform, they may have chance a lesser organ fat. Or suppose somebody has a pot belly, kind of a waist circumference. Suppose they have a central obesity, the chances of organ fat is very very high, and the health risk is very high. So how to reduce the particular fat? Though it's active fat, it's a good fat sometimes, but it has to be reduced. How? Like any, just weight reduction is more than sufficient to reduce the organ fat. So the first one, when you do weight reduction, the first one to disappear is always the organ fat, then only the external fat or the subcutaneous fat. And the same way, suppose if you do intermittent fasting, the most of the data shows intermittent fasting is more helpful to reduce the organ fat. So whatever the fat is not good for the your health. And the same way, suppose you have an organ fat, the problem is, as we told you, the cardiac problem, cancer, blah blah things. But even suppose you are going for a surgery for some reason, suppose you're going for a hernia surgery, so the mesh, it's very difficult to keep the mesh. Or even doing surgery, the blood loss will be, there will be unnecessary excess blood loss, and the mesh or the sutures or the stitch will not hold because of the fat. The mesh will not hold in that place. The chance of slip away is very high. So definitely, fat in any form in excess is not good for health. Thank you.